Welcome to the Maternity Mentor. Today we will be talking about everything you wanted to know about having sex after giving birth and tips to make it great. Stay with us. Hi, I'm Samantha. I'm a board-certified psychiatric nurse practitioner. I have over 13 years nursing experience working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC, perinatal mental health certified, and maternal newborn nursing certified. Being pregnant and having a baby causes a lot of changes to your body. So after giving birth, it's understandable to have anxiety about having sex again. Let's explore what to expect when having sex after giving birth and our best tips to help it be great. After being pregnant and giving birth, it is important to give your body a chance to heal before having sex again. For starters, your uterus, cervix, and vagina will return to their normal size within a few weeks after giving birth. Additionally, there are many significant hormonal changes that take place post-delivery, starting the moment your placenta is delivered. Some of these hormonal changes can make your vagina more sensitive and may also make the vaginal tissue thinner. These and many other factors contribute to the recommendation to abstain from having sex after giving birth. There is no set time to wait before having sex again. However, most healthcare providers recommend nothing in your vagina until you have healed and your lochia, which is the bleeding and discharge following your delivery, has stopped. This means most women should wait 4 to 6 weeks after a vaginal delivery before having sex, and possibly longer if you've had a cesarean section delivery. Women who have had an episiotomy or a perineal tear may also have to wait longer before having sex again. Many women will be told not only to abstain from having sex, but also that nothing should be placed into the vagina after delivery until cleared by their healthcare provider. Nothing in the vagina means no tampons, fingers, toys, douches, penises, birth control devices, and menstruation devices should be inserted into the vagina. It is important that your healthcare provider clears you to resume sexual activity before doing so to ensure you don't develop any complications. Sex is different after you've had a baby. One study showed that at 3 months postpartum, up to 83% of women experience sexual problems related to giving birth. Some common issues related to sex after the birth of a baby include vaginal dryness, loss of elasticity in the vaginal tissues, thin vaginal tissues, bleeding, pain, soreness, feeling like muscles are loose, and low libido. The main cause of these issues are the hormonal changes that occur after delivery. The good news is that after 3 months, these symptoms start to improve and resolve, although it can take months to get back to normal. Estrogen and progesterone are important hormones needed for a healthy pregnancy and proper organ development in your baby. They are also important for having a good sex drive. Unfortunately, after delivery, these hormones drop drastically. This will also cause a dramatic decrease in your desire to have sex. Breastfeeding may also contribute to decreased sexual desire because estrogen levels need to be low to produce breast milk, and estrogen contributes to increased sexual desire. Once you are clear to resume sex, you may want to wait longer due to this decreased libido, as well as the fatigue that comes with having a newborn. Fortunately, as you adjust to your new normal, your hormones will stabilize and you will start to feel your sexual desire return. Before we continue, please remember to hit the like button and subscribe so you can get our latest content to have a happy and healthy family. Now let's talk about how soon you can get pregnant after giving birth. When resuming sex after delivery, many women want to know how soon they can get pregnant after giving birth. You can get pregnant as soon as you start ovulating again, which can be as early as 4 to 6 weeks after delivery. Women who are breastfeeding seem to maintain a natural form of birth control if they are exclusively breastfeeding, because the hormones that promote breast milk production deter ovulation. This effect is strongest in women less than 6 months postpartum who haven't gotten their period yet. However, breastfeeding isn't guaranteed birth control, so it is important to use some form of birth control when resuming sex after giving birth. The reason why using birth control is so important is because women should wait at least 12 to 18 months before having another baby. Getting pregnant sooner than this puts the baby at risk for birth defects and increases your risk of preterm birth. You can speak with your healthcare provider who can review your birth control options and help you pick the right one for you. Pregnancy, labor, and vaginal delivery can cause significant changes to your vagina and pelvic floor muscles. These changes can have negative impacts on sex after giving birth, including pain and stamina. The pelvic floor muscles are important because they provide support for the uterus, bladder, small intestine, and rectum. An important way to prevent pelvic floor injuries, as well as healing from them, is to perform Kegel exercises. Kegel exercises are a series of movements internally where you flex and relax the pelvic floor muscles to build strength and tone. They can be done multiple times per day while you go about your regular daily routine. Kegel exercises can also help with incontinence, which can occur after giving birth. Pilates can also help strengthen your pelvic floor muscles, either in combination with Kegel exercises or instead of them. There are many tips that can help you resume having great sex after giving birth. For starters, don't rush into things. Start with intimate sessions with your partner that don't involve penetrative sex. This can include massage, mutual masturbation, and oral sex. These sessions can be great warm-ups for what is to come. After giving birth, your vagina will probably feel drier, and the tissue may be thinner, which can lead to bleeding during intercourse. To assist with this, make sure to use plenty of lubrication. Water-based lubricants are preferred, and they go a long way to making sure you're having pleasurable sex. Be sure to spend plenty of time on foreplay. Foreplay can help increase the blood flow to the vagina, making sex more enjoyable, increasing your ability to have an orgasm, and allowing for your own natural lubrication to occur. Be sure to make time for sex because rushing it can lead to disaster. Plan times to have sex when you have more energy, like afternoons when your baby may be napping. As penetrative sex becomes more enjoyable, plan on quickies too, because they can be fun and a spontaneous release amidst all the chaos a new baby brings. Use over-the-counter medications like Tylenol in the beginning if you are finding that sex is painful. This can help make things more comfortable for you because the first few times can be uncomfortable. However, sex should not remain painful, and you should speak with your healthcare provider if you continue to have pain. Finally, be prepared to talk with your partner if problems arise. Check in with them and let them know how you are feeling about sex, what is working for you, and what isn't working for you. Experiment and be open to change when having sex after having a baby. Don't be afraid to try new positions or retry positions that prior to the baby you may not have enjoyed, because now they may feel amazing. Finally, be open to adding adult toys to the bedroom, which can assist with more pleasurable and enjoyable postpartum sex. Sex after giving birth can seem overwhelming. I hope this has helped you learn when it is safe to start having sex again and giving you some tips to help make it great. Please share your comments and let us know what topics you would like to hear more about. If you like this content, please remember to hit that like button and subscribe so you can be the first to receive this information. Remember to share this channel with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.